Hey, let's go. Freedom. Freedom.
To escalate on talking about I have been targeted. Period. Targeted. It is not a coincidence that what I'm getting to is after Dr. Mihu and I started, I started seeing her. My first consultation was, of course, in person. She did the little, evaluation, communication, or whatever, Okay, breathe in, breathe out, that little shit. Okay. And I've been taking pictures and documenting it, everything I've been going through. So I'm showing her all these pictures with the discoid rashes and everything, my face, all of this, right? Oh wow, okay, yes. Okay, yes. So we're gonna go ahead and do blood work and da 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 da. Okay, so I feel good in the sense that and she gave me a whole slew of fucking pills to take. So I feel good about the blood work being run to see where I'm at now. Okay? All the shit come back, same motherfucking precursors are there for rheumatoid arthritis and lupus. They're right there. But of course, they're more crystal clear coming from the Quest labs than they were from Harris Health Labs. Needless to say, when I talk about being targeted in such a way to where your records are being altered, your records are being falsified. If you have cancer, they just told you that you got some inflammation. That's the type shit that I actually am going through. This shit is not to be fucking played with. Okay, why should I be calm talking about this? Like what? Okay, so I'm trying my best. I think I'm doing pretty good on this video. Anywho, so she diagnoses me with, like I said, lupus. First it said lupus. No. Did it say lupus first or subcutaneous lupus? I think it said subcutaneous lupus. And then she diagnosed me with rheumatoid arthritis. Then she went back, did some more blood, and she diagnosed me with seronegative rheumatoid arthritis. So I was like, what the fuck? Why is it altered? Like, what does that mean? So, of course, I'm doing my own research. Okay. And every time I get my blood work, my blood results back, I go research what is the normal. If this is high in the red zone, what's the normal? And if mine is abnormal, what could be the reason? So I'm testing to see if my doctor is going to educate me on why my white blood cells was very high. Because my white blood cells have been very, very high. You understand me? Yes. So if the rheumatology centers, the centers of, what do I call that fucking place? Rheumatology Centers of Houston said because of the protein urea that Harris Health diagnosed and have it right here, I need to see a nephrologist. Why is it that after being with Dr. Mihu since November of 2023, has she not suggested that I see a nephrologist? So that's what the conflict of interest was on my most recent telehealth visit with Dr. Ramona Mihu. So, yeah, it's definitely a conflict of interest if I'm telling you about how more substantially like I am disabled. And not only that, so I applied for MetroLift and I got approved. And so I thought, okay, I don't have the money. I don't have no $400 to buy no bariatric rollator. Okay, we just don't have like extra like that. You know what I'm saying? We gotta buy groceries, toilet paper, everything, right? So anyway, but I got a wheelchair. So I said, okay, the MetroLift can send me a vehicle where I can be in my wheelchair on my ride. And then my daughter can push me in to do what I gotta go do. Okay. She pulls the wheelchair from downstairs, wipe it all down, Lysol it down and everything because it's full of that nasty shit that's coming in this apartment nonstop, even without the air conditioning blowing. So I was like, okay, sit in the wheelchair. I can't sit in the wheelchair at all because of my thighs are grotesquely swollen with fluid packets. Okay? Pockets of fluid. So on this consultation that I have with Dr. Mehu, which was January the 7th, 2025, I'm telling her this. I'm frustrated because so far into the consultation, I'm really annoyed because I can look, we're on a video thing that I record. I've recorded everyone we've had. And I'm talking to her, and I just can't understand why she's like got this old flipping to the side look. So because my little video is way up here, I'm like kind of doing like this, looking up, because my daughter moved this phone right here. So I'm just kind of looking up like this on purpose as to not see her because she's full screen. So she's like, yeah, because that's her tone. So I was like, yeah, but Dr. Mehu, like I'm swelling to the point where I can't wear panties. Do you understand what that means? I can't wear panties. Okay, so when my time of the month come, I do wear panties, duh, but I'm in anguish because not only is the menstrual cycle bringing on a lot of more swelling, which she and I already discussed, that because I'm a woman and this condition and the hormones, and she was doing what Ashley called it, word salad. And I'm like, what? So I go look it up. And yes, when a woman is coming on her time of the month, the lupus symptoms of the inflammation and all that stuff can be exasperated. But never is she like making it make sense on why that is the case. And so what we can do is, I need a doctor that's talking about solutions. I need a doctor that don't want to just think you're going to get your little kickbacks and whatever you're going to try to get because you keep on trying to get me to take poisons. It's not going to work out. It's not going to work out in your behalf because you're not going to use me as a lab rat. I'm not going to be minding my business. And next thing you know, I'm up. Because the pill and did some crazy ass shit and knocked some shit off. And then I'm at the ER and y'all talking about, oh, she ain't got no insurance. Just let her sit in there and die. Y'all got me fucked up. All of the whole system. The whole secret society system, y'all got me fucked up. Okay? For real. Y'all picked the right one at the wrong time in her life. 50 years old, I'm at my golden years. And this shit is going on. I'm being targeted. What? Okay. Anywho, so she's just really being flippant. She's really like, okay, we got, like. So I looked at her in the big screen right here, and she's going, yeah, okay, well, if you're going to still live in the environment where, the mold is, and then that's the reason for the inflammation, and that's never going to go down. And so what I'm telling you is that if you go ahead and take the hydroxychloroquine, just take one. But if you're not going to do the medication, that can at least help you. Now I'm getting pissed off. So it is you all about getting me to take this fucking poison. I don't call it a medicine. Okay? Some Robitussin, that's medicine. It tastes nasty. Your chest hurt. It's horrible. But you like, and you're going to be better. But then you like, I ain't taking that shit. Must got a lot of alcohol in it. It's making me dizzy and shit. You get you some honey. If you ain't got an allergy to it, you get you some honey. You get you some lemon. You do that. Old-fashioned tonics. So that's what I've been doing to keep myself going. Okay? So she's like being very flippant with me telling her that I've read the reviews on this hydroxyquinone, whatever it's called. And people said they literally broke out with what's that shit called? Shingles type rash. Other people saying all this. I am super sensitive to any symptoms that a drug, a poison say that it can give a person. I'm super sensitive to it. I promise you this. Okay? So she's like doing like this, and she's literally doing it. Like I said, she's literally doing it. So again, I start looking at my little picture up here just to like, just try to look off, and she's like, I said, look at the swelling. Why is it that I don't need to see a nephrologist? I don't want to be on dialysis. Look at the swelling, because I found a picture and I'm showing her. She's like, yeah. So I'm showing her the pictures from way back in 1904 when my legs was super fucking huge. And she rolled her eyes. She literally did that shit. So I gotta get a rheumatologist, the Most High God, has placed in my life that is going to honor the oath that they took to save lives by practicing preventative measures. The oath was to do no harm and to practice preventative measures. I'm nauseous right now. I'm nauseous as fuck right now. My head is like having this weird low throbbing thing going on. I'm feeling the dizziness. I'm feeling like, oh God, the nausea. And of course, anybody knows that if you have lupus, you cannot be getting all stressed the fuck out. Look at Toni Braxton. Whenever she was literally finna do some kind of a music thing or whatever, and her shit is all over the place, she got to sit her ass down. Because it won't be no Toni Braxton. She just made a comment that said, had she not went to the cardiologist when she did, she could have died because something was going on with her heart, dealing with the lupus. So I even asked Dr. Mihu, why did you diagnose me with subcutaneous lupus? If the skin is the biggest organ on the human body, it says SLE can affect every organ on the human body. So why would you just diagnose me with the subcutaneous one? So that has always been putting like this put me in this mood of like, are you just playing around and shit? You know what I mean? Think about that shit. Subcutaneous lupus. My skin is a part of my body. It is the biggest organ on my body. Okay? You should know this, medical doctors. So why would you say it's subcutaneous? So as to insinuate that everything that'll happen to me would strictly be with my skin. Well, we see what started happening with my scalp, the lesions. I talked to her about that because on the last consultation, I still had a little wispy hair on my head. This time I'm looking just like this on the video, and never did she ask any fucking question whatsoever about my hair. Yeah, never. Okay, so I said yes, and like I told you, whatever this strange lesions was coming on my scalp, they were hurting so bad. I was scratching, and so I didn't feel good about treating it with my tea tree oil with still having hair. So once it healed up to the degree, and I disciplined myself not to itch it, then I cut off my hair. But of course, it grows back instantly. So that's why I look like this today. Okay, so I don't know if this baldness here is just female pattern baldness. Okay, this right here is traction alopecia that I had for years since I was a child. But this right here has never been the case. And it just literally just left my head. It did not fall off by in clumps or when I'm picking out my fro or anything. It just left. I said, and I'm an African-American woman. So I know about my hair texture. And my hair literally feels like wires. It literally feels like barbed wire, like Brillo, like a Brillo pad. And that's how my hair was feeling when it was still on my head. So I was like, what's going on with my hair? Remember me talking to you about it? She has zero fucking empathy. She just like, yeah. Then we got to talking about the insurance. I told her I wanted to change the insurance plan. I said, so what all other insurance do you take? Because I don't think this community health choice is really helping me, because I did attempt to try to get an MRI right here close to me, right up the street. And they're going to talk about they don't take the community health choice. Why is that the fucking case? Nobody takes this community health choice. So why the fuck should I keep it? Or, I'm not saying this to her, or is it just me that's being targeted? Yeah. So let's get to the meat of the pie. That was so juicy, right? That was the crust. Let's get to the meat of the pie. So I see Dr. Mihu January the 7th, 2025. On the next day, I had an OBGYN appointment set up with the same gynecologist my daughter goes to, and that uses the same insurance. We got the same insurance. I already stated that earlier. All of a sudden, I get a phone call from the gynecologist. Okay, let me say this part. Let me not skip. So I'm telling Dr. Mihu, I said, well, I don't know what to do. I said, why did you say that my disability is permanent? Like when you did the DHS papers, you did put on there that I'm being evaluated to be properly diagnosed, right? But then when you did the Metro Lift paperwork, you put permanent. Well, it is permanent because unless they tell us different, autoimmune diseases is permanent. Okay, yeah, right? But so does that, you see how that sounds for her to say that no, it is permanent because you have the autoimmune. She didn't quote, you have the autoimmune disease, lupus and rheumatoid arthritis, and that is permanent. That is something that, due to hereditary purposes, for hereditary reasons. But no, this is something that, due to your age, this is the way she should have been consulting with me, as in to educate me on things that I probably don't know. Yes. So she tells me that my conditions are permanent. Why would that not sound like, oh, hold on, wait for it. Amina is affiliated with the Harris Health System, right? Shazia Amina. Dr. Mihu says she also is affiliated with them or knows them, some shit, right? So for her to say, no, we're not going to use, we're going to use Quest for your labs. Because I was telling her my labs look so weird through Harris Health that I'm not really sure what the hell they really saying is so seriously wrong with me, but I'm really sick. And she goes, no, we're going to use Quest. This is our very first consultation. I said, oh, okay. She said, no, we're going to use Quest. And so my point is to say that she came in and gave me a paperwork. So I was like, what's this? So, oh, this is your records from Harris Health. So I'm like, I was like, okay, maybe I filled out an authorization for her to pull my records. So I'm asking Ashley, I said, did you do that? You remember you was the one set the appointment up initially and everything. So did you send them anything? Did they ask for us to do an authorization? I don't remember that. Did you bring me an authorization form? She's like, no. I said, and I didn't fill out anything when I got here. I paid the premium. And then I came back to the room. And I've been sitting here waiting for her to come in here to see me. So whatever. So I just shrugged it off. That she literally gave my daughter a pack of paper that she pulled off of the Harris Health system of my blood work or whatever the hell that was that she gave my daughter. So I was like, so for her to say that my situation is permanent, would that not mean that you looked over everything that the Harris Health System had already had in motion about me? And we didn't discuss this in my initial consultation. So why is it a secret? And now all of a sudden you're saying, no, your condition is permanent. Now, why would I want to continue to see a doctor who's telling me, oh, yeah, you're going to die with this? But now with my disability, you're like, oh, I can't say nothing on your behalf. I can't fill out no papers on your behalf. Like, if some weird shit started happening with her demeanor, her way of treating me became really strange when I started issuing her papers to fill out for like MetroLive, this and that. She started being more weirder and taking her time to do anything for me, just like I was supposed to get the new MRI paperwork and supposed to get the new blood order paperwork, and it never came. And we on what? What's today's goddamn date? January 17th, 10 days later? 10 days later, and I don't have the MRI paperwork, and I don't have the new blood work paperwork. What's the tea? So anyway, I tells her, I say, okay, yeah. She's like, well, if you want me to, well, you gotta do the test if you want to know what's going on. I said, oh my God, like I have to control myself. I said, Dr. Mihu, the whole purpose of you filling out my MetroLive paperwork is so that I can use my wheelchair, because the insurance don't cover shit. So I can't get no medical equipment based on what this bullshit insurance is, which is what I told you, was talking to you about upgrading and asking you what insurance you take. Then you gonna tell me to call your secretary. How a doctor don't know what the fuck they take it all. They don't know nothing. They don't know how they get paid. They don't know nothing about nothing. What? Ask your medical secretary. You mean every time we try to call your office, we can't never get nobody on the phone no more? And that's what you think after we get off this talk, you can put me on pause and get your goddamn thing and tell me, do you take this, take that? That's how we can do this on this consultation. I'm not finna hang up. Get off of this and then call and we don't get no calls. We don't get the phone, don't get answered. What the hell? That started happening too. Not answering her phones. Nobody, her secretary, nobody answers the phones. Yes. Okay. So she's like, yeah. And so we're going to go ahead and do that. Well, okay. Well, if you want me to, I can give you a new MRI paperwork to Memorial Hermann in the Heights. And I said, Dr. Mihu, I have to have an open MRI. So for you to just, do they take, and I'm already sure. Why is it that you're acting like you're not sure of anything? Again, I'm going to piggyback on my experience with Terrence. Nobody that he went to acted like they didn't know who takes what and who do what. When he was referred, they already know. They take his insurance. They have these facilities and what he needs to have done. I'm the one driving him around to get all this shit done. So why would I put myself in a wild goose chase? If there's a problem where this doctor's office keeps doing that shit, we need to handle that. You're not having to have me going on a wild goose chase, driving all around and dealing with this nigga and all that shit. Hell no, you ain't finna make my life harder and worse. Worse than it already is. Nope. So I know for a fact that this is a targeting situation. This is something that's purposely, intentionally being done. Okay, yes, it's ridiculous. So I still haven't received the new MRI paperwork from Dr. Mehu, and I still haven't received the new blood work order from Dr. Mehu. This the same thing happened on my last consultation with Dr. Mehu, which happened, I believe, August of 2024. Same thing happened. We had to keep, my daughter kept calling. Finally, and in that consultation is where she did the paperwork for MetroLift. We went through so much to finally get her to focus and do that. You would think that after each initial visit, a doctor sits down, they do their notes, they do what they need to do, and if they need to go ahead and see their next patient, that's sitting right there for them to complete it. I can't tell your motherfucking ass how to do your job and how to prioritize your time. But what you're not going to do is treat me like my life ain't a priority. To me, to where you can continue to treat me the way you've been treating me. It's not going to happen. So I got to find me a new rheumatologist. And what I'm saying is that something funny style is going on with this healthcare marketplace with Community Health Choice. I don't know who else involved in the fuckery, but I'm going to go with who I'm dealing with. Community Health Choice. And so since they're talking about Trump, it's about to be sworn in. And I was reading and hearing about him doing away with this Obamacare, which I'm thinking is that healthcare marketplace shit. Because that's the baby. That's Obamacare, that's the baby. That's the baby right there. You okay? Yes. So I think I did really good on this video. I didn't want to make it that long, but what the fuck ever. To talk about this shit in the zigzag circus act that I've been going through with these so-called doctors is ridiculous. Okay? It's ridiculous. Okay? And to think I would be able to just talk about this in such a politically correct way throughout the entire time of discussing this shit. So, yes, something weird happened. Oh, that's what I meant to say. So I'm telling Dr. Mehu that I have an OBGYN appointment set up for the next day, January the 8th. And that through that, she can order me my blood work and all of that because I'm having issues with, my menstrual and all that stuff and, go that route. Okay. And I said, and it's right by the ER. So then I'm going to go there to try to figure out what's going on with all this goddamn swelling. And then automatically, after we get off the call, I get a phone call by doctor from the OBGYN saying that my insurance has been canceled. Saying that my insurance had been canceled. But guess what? Once my daughter get all the paperwork together, the insurance has not been canceled. So what the fuck happened? After my daughter go retrieve all the paperwork, I'm clearly seeing right here it's active, as well as speaking to Keystone, who works for Harris Health System, and them saying, no, your Community Health Choice plan is still active. But the premiums have not been paid. So now what does that do? Piggyback right back to Harris Health. Guess what? Right after that phone call, somebody goes into the motherfucking system and pays $56 of the premium. So what the fuck is really going on? I don't know what secret society, Eastern Star Group, whoever the fuck is involved in whatever. But I promise you, hey, when I feel like how so many people are targeted like this, so many people are hurt, harmed, and injured, and so many families are busted up, just busted up because somebody decided to play with somebody's life. These motherfuckers keep trying to play God. And whoa, you picked the right one at the wrong time. I'm going to go ahead and end this one for right now. I'm going to stay in cosmic wisdom. I'm going to continue to, do my little diamond paintings and everything. You know what I'm saying? Oh, hold on. Let me show this. Because I need this to be a part of this video. Okay, hold on. So my daughter knows I have a habit of saying, it's the audacity for me. Yeah, it's the audacity for me for y'all to think you're going to get away with the shit y'all been doing. Okay? And she literally found me a diamond painting that says exactly that. It's the audacity. It's the audacity for me. Yeah, it's the audacity. She found me one. So that's the one I'm gonna start working on. Shouldn't take long. It actually fits the series of the Not Enough Sage for this shit with the skeleton. Okay, all right. So the death, it always represents a rebirth. Again, you picked the right one at the wrong time. Yeah. So anyway, guys, y'all stay in that cosmic wisdom. I hope that one day that all my content that's documenting everything that I've been going through, being a targeted individual, with whatever it is, whoever the fuck it is, okay, the government, okay, that's how I put them all in that one group, the government, whoever it is, it doesn't fucking matter to me. The government, okay, because the ways that they can target you and attack you is in these systems that they put in position to say, okay, well, have you done this? Did you fill out your application about that? Okay, where's your ID on this? Do you got that about that? The system. I'm being targeted by the government. Okay, guys? So that's okay, because you picked the right one at the wrong time. May the force be with you. Peace.
Can you help me? I need more energy.